Welcome, everyone, back to another episode of the Parkinson's Policy Podcast, where we advocate together to raise awareness and advocate and advance meaningful policy for the Parkinson's community. From Washington, D.C., directly from the U.S. Capitol and beyond, we bring together senators, representatives, researchers, and advocates to amplify the voices of people living with Parkinson's disease and the community. My name is Dr. George Ackerman, the founder of Together for Sharon and Sharon's Son, along with my co-host, Margaret Preston, the president of Power Over Parkinson's. I want to welcome you back to another episode.
Thank you so much, George. I'm so excited to introduce our next guest. Jessi Keavney is a caregiver advocate whose father, uncle, grandmother, and grandfather lived with Parkinsonism and dementia. After learning she carries the pathogenic genes for Parkinson's disease, she has spent more than a decade participating in over 40 biomarker and observational research studies focused on early detection and disease prevention. She's a leading advocate in prodromal Parkinson's research, contributing as a conference speaker, research, and grant consultant, and co-author on multiple peer-reviewed scientific publications. Jessie's a practitioner CFO, a certified management accountant, and graduated summa cum laude with a master's degree in business administration. Jessi, thank you so much for being with us today and your amazing work in advocacy and research.
Thank you very much, Margaret and George. It's really a pleasure to be here with you guys.
Thank you.
Well, I agree. Welcome to the show. It's an honor. I had the chance to meet you. It was just perfect timing. And then also the exciting news on the council. We both want to congratulate you, and you're our voice too, so no pressure, but we know we're in good hands and hope to be a part of that process even from the outside. I mean, I always tell Margaret, I feel like we're now a reporting channel. This is the news for Parkinson's policy because it's nothing like it out there for some reason, but I think it's not just part of history. But I know when you were named and we just saw the results, I was so really excited, and that's what inspires me to want to keep advocating. So thanks and congratulations.
Thank you very much.
Well, as we get started today, we're curious what encouraged you to, I know you have a history, unfortunately, and loss myself too, and Margaret's dad is battling today. I'm thinking of him literally 24/7. Even when I want to take a break, it motivates me to keep fighting. But was there something specific or, what encouraged you to really stand up, be a voice, and fight back in a way?
Yeah, I think it's really my family is my why. With my dad and my uncle, caring for them with Parkinson's and knowing that my grandfather had Parkinson's. Then obviously, I have a genetic variant that increases my risk of Parkinson's. And then I think about my children, really. And I want a future without Parkinson's for them. And so everything that I'm doing as far as advocacy and research and trying to really move the needle is all about hoping that we can cure and treat Parkinson's for those living with it today and also preventing it for the future.
Same 3 children, and often worry. First, I have to explain why their grandmother's not here today, and that's already heartbreaking. But then after you think you have a minute, you jump up and realize you also have to fight for yourself, for those battling today. And again, grateful for the work you're doing, but excited for what's to come.
Yeah. I think we're all tied together, not just through this disease, but certainly having children and understanding the complexities and devastation of the disease and trying to ensure our children at least have a reduction in toxins, et cetera, and also a better understanding of the disease and its drivers and better therapeutics, et cetera. So I want to thank you for that, serving the next generation as well. As George noted, I wanted to congratulate you on being on the National Council. We're so excited to see all that you all accomplish. I wanted to ask you what that means to you as now a member of the National Council.
Yeah, I think we're still pretty early in this process. So everything's not fully defined yet. So we're still trying to figure out where we're going with it, but there's a real sense of momentum and excitement about it. And I'm really excited that, for the first time, we're bringing real coordination to research, care, and prevention. And historically, those areas have been rather fragmented. There's different agencies, there's different priorities, and we're not always aligned on that. So I'm really hopeful that we can create a lot of synergy and we can really use resources more efficiently than we have in the past, and that we're not duplicating efforts, and that we really gain alignment on all of that. And I see a really important shift happening. It's really going from reactive care to proactive care. And we're, traditionally diagnosing Parkinson's after a significant amount of neurodegeneration has already occurred. And we're starting to talk about identifying people earlier, even in the at-risk and epidural phase. And we're starting to intervene sooner. We're really starting to initiate prevention trials now. And we're doing a lot of work on some of the environmental aspect, trying to stop it before it even starts. And I think that's a really significant development. And then there's precision medicine. That's something that I'm particularly passionate about, even in my own family. People with the same genetic variant have very different pathology and clinical courses. And I think that really reinforces that people are not averages, and our approach to Parkinson's shouldn't be either. It's very individual, and we need to figure out what's causing individual people's Parkinson's so that we can actually pinpoint and target that and then be able to treat it and to cure it. And if we get this right, we're not just managing symptoms better, we're actually changing the trajectory of the disease. And so that's why I think this plan is really important, is to gain alignment on how best to do that.
Like, how many folks have we met along the course of this journey with, well, I think I had Parkinson's 5, 10, 15 years prior to diagnosis. And the fact that we are now, and with your advocacy, waving a flag on saying that's not right, to live with neurological disorder that amount of time without diagnosis is very meaningful, so that we can really mitigate that phenomenon that shouldn't be there to begin with. So I appreciate that advocacy as well.
I was excited to meet you in DC and advocate together. Excited for this show, but even more excited for the June, the first official. It's part of history. It's the first ever council meeting, and I hope Margaret and I might even try and pull some magic. And won't be there live, but we'll do something, here for everybody. It's almost like the sports games, but this is more important. So I'm really excited to not be in the room, but think of you as you're there fighting for all of us as a former, unfortunately, caregiver. As part of the National Plan to End Parkinson's Disease Council, now it's newly named, but what are the most significant priorities currently being addressed? I know it's still early, and how do you see this plan transforming care, research, and prevention efforts nationwide?
Yeah, I think it's a lot of what I just said. We're, like I said, we're still really early in the process, so we haven't really defined all those priorities. A lot of our first work is going to be taking stock and inventory of what's currently out there, determining, what our gaps are, and then, coming up with ways that we can utilize the resources efficiently. And then, one of the first steps is figuring out what do we currently have, and then what are we missing, and then how do we get there, and what's the best way to attack that. So I think that's really kind of something that we're really trying to work towards right now.
I think it's also amazing that we can, meet like this now before, and then hopefully in the future, not just follow up, but keep in touch just to see the progress or the lack of. So it's as we know, we're all excited. I remember jumping up, even though my mother, it's kind of too late, but excited for everyone else still today when the plan was passed. And then, as we all know, now it's 2 years moving forward, but it's still the best things are, yet to come. So I wanted to thank you again for that.
Thank you.
Thank you so much. As someone living with the Parkinson's disease genes and having a family history of this disease, how do you think current healthcare policies fall short in addressing the long-term, day-to-day realities of the disease? We know it's so complex and unique to the individual, talking about precision medicine. And what specific changes would you prioritize to better support quality of life right here as the disease progresses?
Yeah, I think, Parkinson's is often just thought of as a movement disorder. But the reality, as you know, is much broader than that. It's cognitive changes, it's sleep disruption, it's autonomic issues. And there's really a significant caregiver burden as well. And unfortunately, a lot of that is invisible. So it's harder for people to really see that and to understand. And it unfolds over many, many years. It spans, it can span decades. Um, and from the outside, people don't see the physical pain. They don't see the mental fatigue. And there's a real frustration in gradually losing your independence. And all of that takes a real emotional toll, not just on patients, but also on families. It really affects multiple people in the circle. And there's a major issue with fragmentation. Patients are often navigating neurology, their mental health, and physical therapy, and so much more. And without much coordination between all those different providers, and not everyone has a care partner even to help manage that. I have many friends with Parkinson's who are doing this alone, or they have families that are, simultaneously trying to juggle jobs and kids and caregiving responsibilities. And it's really, really difficult. And so if I could prioritize changes, I would probably focus on three things. Expanding access to multidisciplinary care, supporting caregivers more intentionally, and aligning reimbursement with quality of life. And it's not just simply reimbursing clinical visits or procedures alone. It's really about the whole picture. Because Parkinson's really isn't just a clinical condition, it's a full-time life management challenge. There's so much that goes into quality of life and managing it over many, many years.
I never dreamt I'd be an advocate. So, I mean, I was prior to my mother being diagnosed, law enforcement, lawyer, and fighting for victims of crime and their families. And then I kind of got swept up in advocacy because of the loss of my mother. And she had battled it, we think, for 18 years, but she felt alone. And I didn't even know the word disease came after Parkinson. That's for a long story there. But as we all sit here literally live, we're all advocates. We're advocating, and we do it really 24/7 till there's a cure. But as advocacy plays a critical role in shaping policy, as we saw at the forum, what can individuals, families, and communities impacted by PD do right now to help drive meaningful change, ensure this plan and the council has a real lasting impact?
Sure. I think a lot of people do wonder, what they can actually do to make a difference if they're just a single person. But there's actually there's a few really powerful ways that I think people can contribute. For me personally, the first thing that I think of is participating in research. That can be observational studies, it can be biomarker research, there's clinical intervention trials, and even now prevention trials. And you don't have to be diagnosed. Research needs healthy controls too, and that's where caregivers can come in. They can participate in research too. It's not just patients. And then for those of us that are at risk, there's that's where we can have the real opportunity to shape the future. Is starting much earlier. I guess the second thing is sharing your story. Data is important, but policymakers really they really respond to real life experiences. And when people speak up about what it's actually like to live with Parkinson's or how to care with someone with Parkinson's or related disorder, it leads to better, much more informed decisions. So continue telling your stories and making it a real personal connection. And I guess the third is staying engaged. Then this national plan is a huge opportunity, but it only works if the community stays involved and holds everyone accountable so that we can see this all the way through implementation. That includes things like submitting public comments. There's a way to do that. You can find it on the website, and continuing to provide input so that we can all work together and gain really genuine alignment on how to do this and to move it forward. And I think this is one of those moments where individual action can genuinely influence national policy, and that doesn't happen very often. So I think it's a really exciting time for all of us.
I remember when we left DC, it was really the work starts when we get home. And that's what we always say here on the show, that everyone literally listening can reach out for free. It doesn't, it's voluntarily, but it's important to write to your representatives. I know after every show, I'm in South Florida, and I won't say a name, but I write to my representative every single show. Still haven't gotten it in a year, but I'm still going to, after we close, I'll be writing him again. And just for a few minutes, if they want our support in the community, it doesn't matter what party, need to start listening. And again, I feel you'll be a voice for us all in DC. So thank you.
Thank you so much. I wanted to ask about kind of talking about early diagnosis specifically. What reforms do you believe will really be necessary to improve early access to early diagnosis, specialized care, and supportive services for Parkinson's patients, really across diverse populations, including veterans?
Yeah, I think, there has been a lot of talk about genetic testing and biomarkers, and I think we've come a long way there in identifying people earlier before symptoms progress. There's great work happening through initiatives like GB2 and the Parkinson's Foundation to increase access to diverse populations. And they're really going globally and trying to find those people that wouldn't normally have access to these types of genetic testing and biomarkers. One thing that I would love to see is more clinician education around ordering and interpreting these tests. And they're not always very comfortable with biomarkers and genetic testing. So, and also for me, one thing that I'm very passionate about is openness to returning results to participants in research so that they can actually use that information. Personally, I'd really love to see something like a portable personal research record, very similar to someone's personal health record, that individuals can then choose to share with their care team. I know my son and I participated in several research studies at the NIH, and they actually did have some of my results and reports that they were able to put to my health record in a separate section. So that was very interesting. Then, for instance, my pedigree, I can then show that pedigree to my doctors, and they have it. And I can also pass it along to other researchers that I'm participating in other research studies. So they were all sharing information. I think data sharing is very something that I'm very passionate about. And then I think we need faster and broader access to specialized care. Not everyone can see a movement disorder specialist. Unfortunately, I think, we have a shortage of specialists in the area, but I think, focusing on telemedicine and regional centers of excellence is going to be key to making sure that we get to those people that normally wouldn't have access to a movement disorder specialist. And then there's integrated care. Parkinson's, like I said earlier, is a whole body disease, but patients are often left to piece together their own care teams between neurology and mental health and sleep and GI. And my dad and my uncle had significant issues with neurological issues that were very much related to their Parkinson's disease. But we need to build all that coordination in the system and making sure that it's not left just to the patient, to make sure that all these providers are talking to each other and they all understand what's going on in the entire course of the disease. And of course, like you were mentioning, just discussing, and addressing disparities, because access to diagnosis and care still depends on where you live or your background. And that's especially true for veterans, because veterans have an increased risk of Parkinson's-related disorders due to environmental exposures and toxins. And so in my own family, my uncle was actually a Vietnam veteran. And I know from being his power of attorney and his healthcare proxy and really taking care of him in the last few years of his life, it was shocking to me trying to navigate the VA system. It was very slow and frustrating. And I think there needs to be a lot done to help that process. So there's not as much bureaucracy and red tape and trying to get the help they deserve. So when I think about reform, I'm not thinking so much in the abstract terms, but how do we make that experience better for the next person? What are we missing, and how do we make it better?
That's really well said. I think just simplifying it, right, is often a big part of the job. Simplifying it and making it better for the next person seems so simple, but something that could really change the trajectory in a lot of different ways. Diagnosis, therapeutics, and things to help people live well with the disease right now. I especially appreciate the piece in terms of just creating higher level education for general practitioners and kind of your first line medical team to getting them a little bit more equipped with not only the disease, but some of the genetic factors associated with the disease, I think is so important because they are often the first line people go to. And that can make or break leading to a diagnosis in a timely manner. So I appreciate all the things you noted there. There's a lot of work to be done, but I know with a clear vision such as yourself that you have and the rest of the council, I know we'll see some movement, some positive movement.
Yeah. I also worry because as a son of someone, unfortunately, who had PD, I did the DAT scan, didn't show anything, but then they turn around and said, doesn't mean tomorrow you won't be diagnosed. And then I want to do the PD generation, but they don't allow someone, unless you have Parkinson's. I hope they'll change it. So it's about 600. Might do it on my own this summer, but it's still kind of don't know how accurate, a lot of these things are. But again, through the council, I hope we'll be seeing much more. I also wanted to thank you for your work in the past, present, and upcoming, and hope we can continue to be a part of it, by your side, helping in any way we can. And we just want to thank you for your time today. I'm going to send the show back to Margaret.
Yeah, I would like to echo George's sentiment. We're so appreciative of you taking action because you didn't have to. What you're doing is truly monumental for so many people. And I know you collectively with the council and those of us on the peripheral cheering you guys on will do so much good for our community. So thank you for taking action, sharing your voice and experiences, and being so passionate for the next generation.
Thank you very much. And like I said before, make sure that you're utilizing the avenues to submit your public comments. All of those do go to the advisory council because we really need everyone's input and feedback in order to make sure that we're driving this plan forward and that we've got everyone's input. So thank you very much for having me here. It was a pleasure speaking with all of you today.
I think I speak for George, but you're welcome back anytime.
And you kind of made the whole show was encouraging, but do you have any message of encouragement? I know it's always, I feel like this is the movie where part 2 is coming, but we can't talk about it yet because you don't want to give all those details and we're not aware of a lot. But what message of encouragement can you leave the Parkinson's community with today?
Yeah, I've been participating in research really for the last 13 years, and I am genuinely hopeful. I'm genuinely optimistic. I do feel like we are moving a lot towards precision medicine. We're getting better. I know sometimes it can seem really slow, but I think we're headed in the right direction. And I think, there has been a lot of progress lately, and I think we're getting there. So just don't give up. Continue to advocate and to share your stories, and all of us working together, I think we can really make a difference.
I really want to thank you again, Jessie, for your time and friendship. I want to thank my co-host Margaret, of course, everyone behind the scenes at Power Over Parkinson's, Adam, and everyone. We love you, and we especially want to thank this incredibly encouraging and inspiring community. Feel like we're going through part of literal history now with the seating of the council and so much to come. And you could be sure, as they will joke today, we're us reporters here at the front line in the Parkinson's community and the show. And hopefully one day the station will really be the first to report some of the impactful policy coming through, especially direct in June from the council. So I want to thank you, Jessie. Thank Margaret. Thank everyone, too, for listening. Please share the show. Please support Jessie, too, and all her work, not just here in the council, but also outside in the community. This has been another episode of the Parkinson's Policy Podcast, where we advocate together to raise awareness and advance meaningful policy for the Parkinson's community. Please stay tuned. We have a lot more shows to come because we still have work to be done. You can be sure the three of us will be fighting right by your side. See you soon. Thanks, everyone.
Thank you.